I'm Dr. Deanna McCosham, Medical Director for Extension Health. This video is an overview of the HealthWorX plan, the elements that go with it, and the logistics that make no-cost healthcare too good not to be true. This is a guide for employers. The first thing I want to show you is what is HealthWorX and why do you need it. I will explain the essential elements of the HealthWorX plan and the purpose for each one. The first element you see here is a Minimum Essential Care Plan, or simply put, MEC. Our MEC plan comes with both preventative care visits as well as sick visits. Preventative care visits have no copay and no deductible, and employees can visit a doctor as often as they wish, provided that the service is for one of the preventative care measures on the ACA list. Again, for preventative care, there is no copay and no deductible. Our MEC plan also includes sick visits to a doctor's office, clinic, or urgent care facility to see a primary care physician or a specialist. There is still no deductible for either of those visits, and their primary care visit has only a $20 copay and the specialist a $40 copay. And the employee does not need a referral from a primary care physician to see a specialist. The network for Minimum Essential Care Plan is called HRX Open Access, and our plan is accepted by all doctors who accept Medicare. Another element in our plan is the hospital indemnity. The hospital indemnity is a cash benefit given to the employee if they are confined in a hospital for a covered illness or injury. The benefits are paid in lump sum amounts and can help offset expenses that the primary health insurance doesn't cover, such as deductibles or coinsurance, or it can even be used for non-medical expenses such as groceries and housing costs. This coverage is HSA compatible, and the employee is guaranteed coverage without having to provide information about their health. And how much is the actual coverage? For a first-day hospital confinement up to 1 day per year, they will receive a cash benefit of $2,500. Any subsequent day, they will receive an additional $100 per day up to 30 days per year. For daily ICU confinement from day 2 and up to 10 days per year, they will receive a $200 cash benefit per day. The next element in the plan is our health risk assessment. The purpose of the health risk assessment is to gather as much health-related information from the employees as possible and evaluate current health conditions. In order to facilitate this, our bilingual wellness coaches, certified nursing assistants, and doctors will reach out to the employees, visit their work sites, or the employees may complete the health risk assessment through their online portal or by calling in and speaking to one of our bilingual representatives. Our plan also includes chronic condition management or wellness coaching. The information provided in the health risk assessment allows our providers to create individualized programs for each of the employees participating in the HealthWorX program. These programs will vary depending on the chronic conditions such as high blood pressure, sleep disorders, stress, and so forth. If there are a significant number of employees that fall into a specific chronic condition, our providers will create a group plan so that employees will get both individual and group support. As part of our HealthWorX program, we also include the Basic Life and AD&D or Accidental Death and Dismemberment Plan, which offers a benefit amount of $25,000, which is guarantee issue and portable, for which employees can also add dependents. This plan also pays benefit amount in the event of lost limbs, loss of eyesight, loss of speech, or hearing due to an accidental injury. The final element is our telehealth service. Our telehealth service provided by Teledocs is provided not only to the employee but also to his or her entire family. The employee or their family member can speak with the medical provider within a short period of time through a telephone or video consult from the comfort of their home. The provider can at that moment make a full assessment, diagnose, treat, and prescribe any medications if necessary for the employee and their family. Remember, there is no copay, no deductible, and it can be used as often as desired. Finally, I also wanted to mention that our telehealth and our minimum essential care plan both come with pharmacy care. We have partnered with GoodRx, allowing our employees to receive an average of 70 to 80% discount on all prescriptions. Now, if that doesn't sound good enough, then I have one more thing: healthcare for all. Extension Health allows healthcare access to each and every one of your employees, even those employees who do not qualify for the HealthWorks plans because they didn't make enough money on their paycheck or they don't work enough hours. Our nonprofit partner, Extension Health, will still offer free telehealth and wellness services to those employees with no premium deduction on their paychecks and no subsidy to be wired back. These services are simply free and donated by Extension Health. So now let's talk logistics and how it is possible for us to offer you this plan at no cost. As you can see from the chart, the employee enrolled in HealthWorks is going to have a $214 deduction per week. That deduction is pre-tax because this is a qualified cafeteria Section 125 plan. Such deduction reduces taxable earnings from $500 down to $286. This creates a tax differential in their Social Security of about $13 and in their Medicare of about $3, not to mention a complete elimination of state tax and a huge reduction in federal withholding. The employee's total tax obligations for the week drops down from $70 and change to $26.63. Next, the non-taxable subsidy that you see here is a non-taxable donation that comes from Extension Health, which is a 501c3 nonprofit which provides the wellness and telehealth services to the employees. The combination of tax savings and donations ends up increasing the employee's net pay over $25 per week and over $100 per month, resulting in an annual net income of $1,300 more than the employee earned before enrolling in the HealthWorks plan. These are truly amazing numbers. So now you must be wondering, how does this process take place? The answer is fairly simple. The employer pays their premium for the healthcare program via wire, simply by deducting the employee's contributions from their checks on a periodic basis. As soon as the premium is received by WorXat HR, WorXat HR pays the nonprofit for its telehealth and wellness services. Once the nonprofit has received payment for services, it will then wire back to the employer the amount of the premium it is donating or subsidizing for the employees. The employer simply distributes those subsidies on the employee's checks along with normal payroll as a non-taxable credit. The subsidy is a tax-free credit provided to the employee through the nonprofit. Just as the employee has a significant tax savings in the cafeteria plan, so does the employer. Remember that Social Security and Medicare are shared taxes, and whatever the employee saves will be a savings for the employer as well. On average, employers will save anywhere from $60 to $67 per month per participant. WorXat HR bills the employer a monthly fee of $30 per participant, which results in a monthly net savings of $30 to $37 per participant for the employer. Again, these are just amazing numbers. But let's break down the process even more, step by step. As you can see, the employer deducts a pre-tax premium of $214 on the employee's check. On average, that would generate a $15 to $20 FICA and unemployment savings for the client and a $25 to $30 savings for the employee. The savings for the employer is not quite as significant as for the employee because remember, the employee also saves under withholding. The client will then pay WorXat HR the premium of $214, which was deducted from the employee's check. However, the client or employer gets to keep the tax savings of $15 to $20 in FICA and unemployment. The nonprofit will then wire back the $196 donation to the employer. The employer will then take that money and distribute it to the employee on the check for that week. As we can see, the donation plus the tax savings minus the premium nets the employee out an additional $7 per week. The employer tax savings of $15 to $20 per participant works out to about $60 to $80 per month per participant, from which the employer will pay WorXat HR $30 as their contribution to the employer-sponsored health plan. One additional note, for California employers, the $214 Section 125 deduction is not subject to workers' compensation premium, which generates additional savings. But again, this is only for California employers. Finally, we wanted to remind you to be aware of companies trying to incorrectly emulate our plan and also to distinguish us from simple reimbursement plans. The IRS has issued memorandums regarding plans that arrange a reimbursement for fixed indemnity benefits. These plans generally require the employee to participate in a certain prescribed health screening or activity without regard to the amount of the reimbursement or expense. Our plan involves neither a fixed indemnity nor a reimbursement, nor does it require the employee to complete or participate in an activity. Our plan qualifies as an ERISA Section 125 plan, and the employee's subsidy comes from an IRS certified 501c3 nonprofit whose mission as a charitable organization is to subsidize healthcare and wellness plans for lower income employees. We have received all clear opinions from a former IRS chief counsel, and our plan documents are authored by the Groom Law Group. So please, make sure you are aware of these types of companies that are out there and have this information when reviewing any plan that claims to be similar to the HealthWorX program. And finally, remember that with Worksite HR, you are not alone. We are all in this together.